disease that occurs in association with rheumatoid arthritis. We don't have a case out here, and not that you'll always get an ILD with rheumatoid arthritis, or if you have a case of rheumatoid arthritis, you are going to get a case of ILD. But this is a representative case on the basis of which we would be probably discussing an approach to the respiratory system examination. So, a couple of tips. I'm sure your instructors and mentors have already told you about this. The maximum time wasted after entering a station is while you greet your examiners. A lot of people would stand, fumble, regardless of what to do, and they would individually greet the examiners. You know, one of the most acclaimed but less known examinations in UK is the MRCGP international examination, where the examiners are meant to sit behind the candidate. They are not allowed to look at the examiners so that they don't get distracted, they don't waste time. You are supposed to just come in, hand over your badge and start your examination. Unfortunately, we haven't yet adopted that style in MRCP examinations. But do not waste time on greeting and taking a nod from your examiners. Every second is very, very vital. The 20 seconds you would spend out there is time lost. So enter nod to your examiners and straight away approach the patient. Never forget to whatever is written outside your station. That contains valuable information that will tell you exactly what to do. So in a respiratory examination, what I would do is, I would take the help of this gentleman. He would help us.
Take out the shoes?
No, not at all. You can just sit out there. Shoes probably you can take out. That will make you feel comfortable. So we are just going to do a demo. We are just going to give you a glimpse of what happens. What I want you to do is, I will be leaving gaps in my examination, and I want you guys to mark me out as to where I went wrong. So once you enter the examination suite, I'll start off, try to finish it off within 5-6 minutes, and you tell me where I went wrong. I enter and I sanitize my hands. Hello sir, this is Dr. Subhadip, one of the doctors here in the ward. Can I have your name and date of birth, please?
My name is Subhadip. My date of birth is 6 May 1971.
Wonderful sir, and I am supposed to examine your respiratory system today. That involves looking at your chest, have a feel of your chest from the front and the back, listening to your sounds of your lungs with my stethoscope, and a couple of other things. Is that fine with you? And do you have any pain? Do you have any discomfort? Well, during the examination, if you have any pain or discomfort, do let me know at any point of time. So I'll stand at the end of the bed and have a look at your chest and tube for a few seconds. So, can you show me your hands, please? If the patient is wearing a t-shirt, you can always ask the patient to remove it with his consent. You can turn off the AC if the patient is uncomfortable due to chill. And if it is a female patient, they'll be properly dressed in a robe so that you can examine. Just ask for a chaperone if you are not having a female examiner in the suite. So, can I have a look at your hands, please? Thank you so much. Can you turn them over for me? Can you join your hands like this? Right, so like this. Fine. Can you stretch your hands out and fan your fingers? Can you cock your wrists back? Excellent. So you can put your hands down. Thank you so much. Very good. So in every step, thank you or a sorry would fetch you a good amount of reliability, reasonability from your examiners. So thank you very much. So I'll have a closer look at your eyes. Can you take your glasses off? Can you look up for me as I pull your eyelid down? Can you look down? Can you open your mouth? Can you stick your tongue out, touch the roof of your mouth with the tip of your tongue. Thank you so much. Now I'll have a feel of your skin temperature. You can rest your hands like this. And I'll count your pulses. You're doing all good, you're fine. So, this is not a very comfortable couch. You would have something that can be a little bit further. Are you very comfortable?
Yeah, lie down.
Yes, you are definitely
Very
very
comfortable.
I guess you said because the
That-
couch is not very
that-
stable.
that-
So I'll have a closer look at your chest right now. You can breathe in comfortably. You need not exert yourself. Can you lift your right axilla like this? These are for hidden lateral thoracotomy scars which you have witnessed. On that side, please. Thank you. And once we have done that, we'll certainly go ahead and look at your neck. You need to lie down. Put the lie down and look away from me. So now I'm going to touch and palpate your windpipe, and you might feel a little bit uncomfortable about it. And I'll also feel the heartbeat. Great. We are going fine and you are comfortable. So right now I will be feeling the expansion of your chest, and as I clasp you from the sides, you need to take one deep, nice breath. And you exhale. Fantastic. Again. Exhale. Wonderful. And now I will tap onto your chest and listen to the sound. Like I said, I'm doing a representative examination, leaving gaps for you. Onto the sides, if you may. Thank you. And now I would like to listen to your chest. I don't have a stethoscope, I'm so sorry. So, as I listen to your chest with my stethoscope, you need to just breathe in calmly, in and out through your mouth. Do not, again, exert yourself. To the sides. Wonderful. Now, as I touch the same sides with the stethoscope, you need to say 99 every time, in the same pitch and the same volume so far as practical for you.
99. 99. 99. 99. 99. 99. 99.
Wonderful. I hope you're doing fine. So what we'll do now is have a look from the back. Repeat the same things over again. And thank you. And while we are done, I also have a feel of your neck from behind to see if you have a gland. So once we have done it on the back, I would also like to have a look with the legs. Just pull your trousers up. You have no pain. So much for your kind cooperation. You can cover yourself up, and I would finish sanitizing my hands. I would like to complete my examination by doing a complete cardiovascular examination and survey, look at the smaller joints of the hands and legs and other larger joints if possible. I would like to do a bedside fingertip pulse oximetry, and if possible I would take a blood pressure myself on both the arms and when the patient is standing. So that completes whatever I would do in a station like this, and it's time for you guys to find out where I could have done better. I'm on my marks.
3 points.
Yes, please.
So one is while examining the pulse, you didn't check for the other pulse, for the radial delay. So just examine.
Absolutely fine. But you see, as I say, that the examiners wish to find out, the examiner is also focused. They need to find out how well you know to approach a patient with a respiratory problem. And they have announced that you need to examine the respiratory system. Now think practically, in a patient of respiratory illness, when I am focused doing a respiratory examination, I usually don't spend a lot of time examining pulses, because the time I save would be dedicated to the question answer session where I can score more and win the perceptive judgment of the examiner. So yes, I do agree I could have done better. I could have checked for collapsing pulses, I could have checked radiofemoral, whatnot. But in a respiratory examination, I would rather point or rather spend my time on those things that are really required. And I can always mention, as I say, I'll do a complete cardiovascular examination and do a fingertip pulse oximetry, like that.
Second point is you didn't check for after making the patient cough. So
Yes.
post-acid.
Since this is a case of ILD, I could have seen if the knuckles shift after a spell of coughing bout, and if really they change their correct. Yes, that is a gap that I deliberately left out. What else?
The auscultation of apex.
Auscultation of apex rather falls in the cardiovascular examination again, I'll agree, because I could have auscultated the apex as well as the base of the heart, because the second pulmonary sound becomes important as well.
It's a lung apex.
Yes, lung apex I have done. As you have seen, I twisted my stethoscope, used my bells and tried to do it. And yes, you can always say that I would ask for, in a country like us, that would be highly appreciated, I do a routine examination of the sputum if available. Just as you will say that we would do a routine urine examination, routine urinalysis. That's good if you say, that doesn't deduct marks from you if you don't. So that's like, what I would like to specifically point out is, as White has very well pointed out, your examiners are more tense than you. I'll tell you why. If you go wrong, you can appear for the examination again. But if an examiner goes wrong in marking you properly, he would probably be barred from examination for the rest of his career. So they are more tense than you. Nobody is willing to push you to a pass mark, and nobody is willing to restrict you either. So it's very important that you do your job as a doctor, just as you would do it in the wards in your clinic. Be yourself, be confident, but not overconfident. Do not find out something that is not there. Do not try to report something that just fits in, but you haven't really found out. And remember that that point is the most confidence-giving point, that your examiner has got to examine the patient just before you. And probably he also doesn't have a properly clinched diagnosis. Right? So if there's no further question, we'll proceed to the next session. Thank you so very much.